In the United States, 6.8 million people have generalized anxiety disorder, and worldwide, over 359 million people struggle with this illness. It's the most common mental disorder and is also one of the most easily treated. However, for some, traditional treatments do not work. So, what is anxiety? The Diagnostic and Statistical Manual of Mental Disorders, often referred to as the DSM, has 5 criteria that must be met to qualify. First, the patient must have excessive anxiety and worry occurring more days than not for at least 6 months. Second, the patient must find it difficult to control the worry. Third, the anxiety or worry are associated with 3 or more of the following 6 symptoms: restlessness, easy fatigue, difficulty concentrating, irritability, muscle tension, or significant sleep disturbances. Fourth, the symptoms cause significant impairment in school, work, or social settings. Lastly, anxiety cannot be better explained by other mental or physical disorders. So, in layman terms, it's characterized by a lot of worry that cannot be controlled and is beginning to have negative effects on the individual. More biochemically speaking, generalized anxiety disorder is typically caused by a deficiency in serotonin and sometimes oxytocin. Most often, selective serotonin reuptake inhibitors, SSRIs, which increase the amount of free serotonin, are used to treat anxiety. However, as mentioned earlier, that does not work in every case. So researchers are looking into the drug MDMA as an alternative.
So what really is MDMA? MDMA, commonly referred to as ecstasy or Molly, is a well-known psychedelic popular for its joy-inducing properties. MDMA interacts with neurons in the brain to release serotonin, which is the hormone associated with warm feelings and bonding during relationships. This serotonin-inducing property is foreign to other known substances, thus MDMA is a potentially unique but unconventional therapeutic solution. The 5-HT class of receptors is believed to be the main receptor which MDMA interacts with. However, evidence is inconclusive, as it is also suspected the drug reacts with sigma-1 and 2 receptors as well as alpha-2 adrenergic receptors. The elation induced by MDMA, however, is very well known, and the professional therapeutic applications of the typically assumed party drug are being studied.
When it comes to using MDMA for anxiety therapy, the dosage is everything. Forget about the party scene, we're talking about precise neurobiology. According to our reliable research, the magic number is typically between 75 and 125 micrograms. This is how small 75 micrograms really is. Why, you ask? This moderate dose is scientifically proven to unlock emotional openness, but is also used to dial down the fear. It is a very critical dose. Too little, and you won't get that empathy boost. Too much, welcome back anxiety. However, the correct dose will allow that tiny brain crossing molecule to unleash serotonin and oxytocin. These two are the ultimate pro-social team, making therapy truly effective. So in a safe clinical setting, this critical and carefully measured dose is all about maximizing feel-good therapeutic benefits without providing the risks of misuse.
So what does this mean? Structurally and functionally, MDMA allows for an increase in oxytocin release. There are pros and cons to this function. Pros: this promotes an overall content feeling within its user, and alongside the general good feeling, it promotes a sense of safety and comfort within its user, which is crucial to being able to actually address underlying trauma. However, there are limitations involved. As dosage was discussed earlier, correct dosage is extremely important, and the positive mental effects associated with the drug make people who are already mentally struggling left highly vulnerable to potential misuse of the drug. Additionally, the misuse of this drug is dangerous and can lead to neurotoxicity and other neurobiological issues. Another con is also just the general stigma of this drug and the demographic that tends to participate in its usage. It makes it difficult to push for research, and if research ever succeeds, it makes it difficult to making it accessible to the public and to push to doctors, insurers, and pharmacists alike. Despite all the negative talk about the struggles required to overcome to produce a solution is still necessary. Anxiety is a tough condition that impacts a large percentage of people in this country. Although MDMA is not an approved form of treatment for anxiety and research on the effects of MDMA are not advanced enough, researchers are confident in the theory that research on how to safely utilize MDMA's beneficial properties is going to continue.